Welcome to Turbo Impact, where we navigate sustainability in private capital. I am your host, Kenny Chen. Each episode, we sit down with investors, allocators, and corporate leaders shaping the next era of sustainability. We explore how capital is driving the global transition and how today's decisions are shaping the future of impact. Thank you for joining us. This podcast is brought to you by Turbo Net Zero, a pure-play sustainability advisory firm driving impact across the private markets. In this episode, I sat down with Reynold D'Silva, CEO of Hello Health Group, to discuss how digital health is redefining the future of preventative care across Southeast Asia. Reynold is no stranger to building and transforming businesses. He previously led the turnaround of Chope, taking us through to a successful acquisition by Grab. Today at Hello Health, he is leading one of the region's largest digital health platforms, with a bold mission to enable 100 million people to take proactive steps toward better health. In our conversation, Reynold shares why prevention must sit at the center of healthcare in emerging economies, how Hello Health is using data and AI responsibly to build trust and drive healthier choices, and what it takes to pair commercial discipline with meaningful social impact. He also reflects on his entrepreneurial journey and the lessons that continue to shape his leadership. Here's my conversation with Reynold D'Silva. Hi, Reynold. Welcome to Turbo Impact Podcast.
Hi, Kenny. Thank you for having me on the podcast.
You have built and led several high-impact businesses. Can you tell us more about yourself?
Well, I've always been interested in technology, innovation, and creative problem solving. My first startup experience was very early in my career when I started a firm building websites and web apps, for which I used to write the code as well as design the graphics myself. Another key experience in my career was working at large successful companies. So I had several years at Unilever, where I learned the fundamentals of building profitable businesses and consumer brands. I was there part of a team which took over a 250 million euro brand and grew it to over €1 billion, along with a higher margin and some very exciting products. Then I worked for Facebook for a few years, again, helping businesses which Facebook had in the region to grow faster than they had grown ever before. Then I returned to the world of startups with Gojek, which up-and-coming startup at that time in Southeast Asia. I headed the monetization initiative, which taught me a lot about creating a profitable business model for a well-funded startup. I then ran the APAC business at Bima, which was InsurTech and Health Tech, and then went over to Chope. And Chope was a great learning experience about turning a business around, improving profitability, finding new ways to monetize or better ways to monetize. And eventually, we were very lucky we were able to secure an exit. So in a sense, I've experienced the entire startup cycle from start to exit and everything in between, the growth phase, the scaling up phase, solving the problems that come when you are a large one, solving the problems that come when you are small and still trying to figure out how to become profitable. So I've seen what a good business model looks like in the world of FMCG with Unilever and also in the world of deep tech with Facebook or Meta. And I think these experiences have been very, very enriching and very fulfilling.
Now you are leading a healthcare platform. How do you personally connect to the mission of healthcare? And what do you think? What do you see sustainability and climate change have to do with healthcare?
Well, let's start with the personal point first. Okay, so when I moved to Hello Health, and I was trying to ground myself and say what is the meaning of this business for me or for people that I know. And I was talking to one of my friends, and he had had dengue. He had had the dengue virus, and he had recovered. And the doctor had told him, look, there are 3 more dengue virus out there, and you are at risk because you've had it once. One of the other variants of the virus could infect you. You don't have immunity. And if you have that disease a second time, it is very, very risky for you. So please be careful. And through my work at Hello Health, I learned through some of our partnerships that actually there have been big developments in the world of immunization for this virus. And there is now a vaccine available. And my friend didn't know about it. And his doctor hadn't told him about it. Probably the doctor didn't know about it. And so even the very small step of providing this information to someone who needs it can have a life-saving outcome. And of course, there are much bigger steps that we can take, but even this small step means that someone gets a better outcome in their life and in their health. And I think that makes this a great mission, personally relevant to me, and I think relevant to everyone who works at Hello. Your second question, I think, was about sustainability and climate. And look, we do most of our work in emerging markets in Southeast Asia. And people who live in cities in these markets, in these countries, are exposed to climate risks in multiple ways. For example, we have still got very unsafe levels of air pollution in most cities in Southeast Asia. That's causing rising levels of respiratory disease. Now, healthcare, digital healthcare, we can't prevent the root cause, the pollution, but we can certainly get people to do early scans and diagnostics, catching the diseases at a much earlier stage and saving people from both suffering and expense. Then you have the changing climate, and changing climate is leading to extreme weather events. We're seeing it more and more: crazy rainfall, more typhoons, extreme heat. And here we need to watch the data carefully to identify new health risks as soon as they appear and take action. I believe this can only happen through public-private partnerships. Firms like ours, healthcare providers, government organizations, ministries of health, and we need an open information system for this. So we are working on this along with many other players in the ecosystem. And I think that collectively we will be able to help mitigate some of the impacts that you are starting to see.
Why do you believe digital health is so critical for closing access gaps and delivering public good in these markets?
I believe digital health's biggest or most fundamental impact is in influencing people to know their risks and take preventive action. And we can achieve that at a scale with digital health which cannot be achieved through the physical, real-world healthcare ecosystem. Because the real-world healthcare ecosystem is reactive. Whereas digital health can be proactive. It can reach people and warn them in advance about their risks, get them to take scans, get them to take preventive action. The World Health Organization estimates that for every $1 you invest in preventive action, you save $7 in reactive costs which come later. In fact, with immunizations, their estimate is $44. So this can unlock a healthier population. It can unlock a less burdened public health system. And it can, of course, lead to a stronger economy and, most importantly, happier and healthier lives for people.
So now, can you tell us more about your work at Hello Health and what kind of impacts are you aiming to scale across the healthcare ecosystem?
See, we are in a region with about 650 million people. And our ambition is to get 100 million people to take at least one preventive healthcare action in their lives. That could be a diagnostic, a scan, immunization, maybe some elective treatment. As long as it prevents a more serious illness in the future and leads to a healthier life for our users, we believe we will achieve our mission. So we are very, very focused on this.
And we know monetization in digital health, health tech could be challenging and takes time. So how are you balancing that commercial viability given the massive user base you have?
Monetization in almost all tech is a challenge. The way we are approaching this is through focus and discipline. We focus on initiatives where the unit economics are net positive. And we then apply both cost and revenue discipline to improve the efficiencies and margins. We've been successful, Kenny, in improving our EBITDA consistently over the past 3 years, and we expect even more improvements in 2026.
And I'm quite curious, digital health has very strong social impact, but measuring the outcomes could be tricky and challenging. So how are you thinking about the impact measurement at Hello Health?
I agree, it is a challenge. We started by measuring the impact in terms of number of people reached, and we said, okay, as long as we can provide these people with some information that leads to better health, that is impact. I think that's a base level. But now we are working to measure the number of people that we have reached who have actually taken some preventive action. And we think that's a much more, that's a bigger impact. The number of people there may be smaller, but that's a more meaningful impact if someone has actually taken some preventive action. So we've gone from information to action. And the next step would be that, how can we engage with people over their lifetime? Because it's really a lifetime value model. If we can create health outcomes over the lifetime of a person through the right interventions at the right time, then not only we would be doing a good business, we would also be creating a meaningful impact for people. We communicate through regular updates to all our partners, investors. We're looking at ways of doing that in more engaging methods, but our bigger focus is on actually delivering the impact.
So you mentioned it's very important to push forward the people attention to preventative tests, and health literacy could be a barrier in many of these markets. So how do you design your interaction with your users to build their trust and improve the literacy level?
We have been studying carefully the user's own behavior. It's slightly different in different markets, but the broad trends are the same. And we see that, we have gone from the world of, say, websites to the world of apps. I'm not even sure if apps really became a big thing in healthcare, but okay, there was a period where apps were the main focus area for the industry. We are now in the world which is, I would say, partly conversation and messaging and partly AI. And AI itself is, the models which we have today are conversational models. And what we find is that this combination of messaging and AI is really where there is an opportunity to create a greater impact at scale through digital channels than ever before. Because they are more interactive, they are more engaging, and they are more likely to keep someone engaged for a longer period of time, which is where you start seeing more benefits to your health. Now, against that, we have to be cautious, especially in the use of AI. And our principle is that in the space of healthcare, it always needs to be managed and mediated by a human medical expert. In most cases, that's a doctor. And as long as there is a doctor in the loop, we feel that these systems can be used in a safe way, because the doctor is always there to make a check. And in fact, the system and the doctor together may be better than either one of them alone. That is what we see so far. So we're very excited about this space. We think that it really can influence people by understanding the channels which they themselves like to use. Having a conversation is different from reading some information or watching a video. And it's often much more persuasive to get someone to take preventive action.
Very exciting update on the AI side. Can you share more about your vision about AI in the healthcare content in the future? Because it's a question in everybody's mind.
Well, today it's almost as though everything in the world is powered by AI. I want to be cautious there. Mm-hmm. And I would say this moment is about exploring what AI can do and can't do. We have to do that exploration in a safe and scientific way. We have to learn where it can be used effectively and where it should not be used. So we are in an experimental phase right now. What we have found so far, it is a great productivity enhancer. It's a great assistant to a doctor in the medical space. And as long as the doctor's in the loop, you are mitigating some of the risks which are there. We find that it can improve speed of response, because obviously the doctor cannot be available all the time. It can also help the doctor himself or herself to improve the quality of response. And that's quite interesting. And so we find that this combination of human doctors and AI is more powerful than AI alone or doctor alone. And that's the most interesting insight that we have found so far.
So other than AI, are there any exciting innovations or particular business models that you think are very promising? You mentioned private and public partnership. Are there any thing else in your mind right now?
Well, one thing which I find interesting today is making the link between online and offline. So a lot of digital healthcare kind of stops at the online interventions. And we are forging a number of partnerships with healthcare providers in the offline world where, physical interventions can be delivered. Digital health is only the start. Ultimately, you have to go and get your scans done and your blood tests done, and you have to get your vaccinations and other treatments done. That has to be done by a genuine healthcare provider. So building that link, we find, is an area which is extremely interesting, and that's one of the business models we are focused on. The other thing which we find interesting is the whole space of data. We today have one of the largest data sets, first-party health data in Southeast Asia. Now, we have to treat this with caution. There is no business model of selling data. The business model is really about how do we use this data wisely to create value for the consumer. And if we create value for the consumer, we capture a fair share of that value. We have also found that in some cases, you don't need to capture, the full medical health data. That comes with a lot of risks. And building that kind of data capture system requires tremendous investment. Okay. We have found that simple surveys where we engage with the consumer, ask a few questions, we upload a few photographs, we found this to be much more effective. So we're always looking for a practical solution to our main goal, which is how can we help the consumer to get to know their risks in advance? And how can we influence the consumer to take the preventive action that will lead to better health outcomes? So it's partly about knowing the consumer's health and getting that data, partly about the partnerships in the offline world, which help the consumer both to know the risks and to take the treatment.
Very interesting point, because I think a key challenge telehealth is trying to solve is enabling accessibility, bring down the affordability, and focus on the patient outcomes. So for the offline part, how do you measure and think about the patient outcomes because you are digital platform, and a lot of actual preventative testing happen with your offline partners. So how does that patient outcome part come into play?
Well, if the patient has taken an action which prevents an illness, which may be a vaccination or some other kind of treatment, then we count that as a successful outcome. If the patient has taken an action which makes them aware of their risks, which may be a diagnostic or a scan, we also count that as a successful outcome, because it would make the patient aware and would sort of, lead to timely health intervention. Okay? And the way we measure this is partly through data partnerships with the healthcare providers, but mostly through surveys of the patients themselves.
So I want to ask you this question, because you are operating in many countries, jurisdictions, having a very different playbook or regulation around digital health. So how are you being able to navigate the differences? Especially there are also quite distinct cultural aspects in these countries.
So we do see regulatory alignment as a key enabler in this business. And I think, there's a level where you follow the regulations, but there's actually a level where you engage proactively with regulators. And I think when we do this, we find often that our interests are aligned because their goals are the same, to ensure that people have better health outcomes. So engaging with the regulators, I feel, is a crucial part of building a new innovative business model. It is better to do it with the engagement of the regulator than, the approach taken in perhaps some other cultures where you would do it first and then seek the alignment. Here we find it's better to have the alignment in front. Then if we think about operating in different cultures, there are differences. Sometimes we see demographic differences. Some countries in this region, the populations are much older. And obviously they're more focused therefore on issues related to healthy aging. Some populations are younger, they're much more focused on issues related to childbirth, parenting, etc. And those are not difficult nuances for us to manage. Where we have to be cautious, I think, is in understanding what are certain things that are unacceptable in a given culture, and what are certain things that are preferred in a certain culture. And now we have been operating for almost 10 years in 8 different countries. And this knowledge is something that we have acquired over those years. So it's part of the intangible intellectual property of Hello Health.
In terms of scaling digitization, which country are you mostly excited right now, given the potential growing adoption of digital solutions?
Well, we see a fairly rapid adoption of digital solutions in almost all markets. The markets which we are quite excited about are Vietnam, Malaysia, Singapore, Thailand, and to some extent Taiwan, which is of course quite advanced in digital adoption. Even some of the other markets like Cambodia and Philippines, we see growing digital adoption. And it is, I would say, adoption of digital platforms has now reached almost complete penetration in the adult population of these countries. Now, after that comes adoption of digital health, which is still not at that level of penetration, probably at 50-60% penetration, but still growing very fast. And the triggers are, obviously the pandemic was a huge trigger, which got people to adopt both digital platforms and digital health platforms. And now what we find is that having access to consumer health data and being able to use that to engage consumers is perhaps the next biggest trigger. And that's why we feel Hello Health is very well placed in this sector.
Can you share with us more about that Hello Health data part? How you leverage these data insights to help improve the patient outcome, and also get your customers to do more preventative tests?
I would divide our data into 2 broad categories. One is data which we collect on consumer intent. So when somebody comes to our platform, often as they are coming in, we already know what they're interested in, what they're concerned about. So that's the part that the consumer is already aware about. The other part, we use a mix of what we call diagnostic tools, digital diagnostic tools, to quickly figure out what are risks the consumer may have, which the consumer was not aware about. So these are the 2 kinds of data. You put these 2 together, and we are able to quickly figure out what are the right interventions for this consumer, based on their age, based on their stated intent and the things that they're concerned about, and based on what we learn from our diagnostics to understand what they should be concerned about, but perhaps they were not aware. So these are the 3 things, put them together, and you are able to immediately recommend something that is important and relevant, and something that the consumer should take action.
I want to take you back on your entrepreneurial journey. So you led a very successful turnaround of Chope and sold it to Grab. So what is that one lesson that you have learned as the CEO that made this case become a successful exit?
I would, sum it up with a saying from, I think some famous person said this, I am not optimistic, but I am determined. And I think that's the key. Not to be over optimistic. Of course, you do need a certain level of optimism. Otherwise, we would not be in the entrepreneurial space. Okay. But to always be determined, even when things are difficult, even when things are challenging, optimism will not help you, but determination will help you. That is one of the most important learnings. The second is you can't do everything alone. Identifying the right people, the people who can solve problems which you personally cannot solve, getting advice from people who have been on the journey before, learning from others and acting through others. This, I think, is the absolute key. I don't think we would have achieved anything, at Chope or any of the other firms I'd worked at without finding people who had the skills to solve problems and empowering them to solve those problems. So it takes many, many people to achieve these outcomes. And I'm very grateful and fortunate that, I had these people around me at the time.
Final question. I ask every guest this question. What do you think is the most effective way to turbo impact your field?
I think, we have to get out of the office, get into the market, the real world, meet real people, and really observe them, ask them questions, learn their problems, what is causing them difficulty, their pain points. And the more people we meet, the more we learn. And if we keep these people in our mind and in our heart when we are doing our work, our odds of success improve significantly. Okay? More than anything else, I find that this is the key to success in any business.
Thank you, Reynold, for joining Turbo Impact Podcast.
Thank you for having me, Kenny. It's a pleasure.
Great to speak with an entrepreneur like you. Thank you.